What if I told you that the biggest problem with American healthcare system isn't the doctors, isn't the hospitals, or even the insurance companies? What if the real problem is that the system has become so complicated that nobody can fully understand how all the pieces fit together anymore? And after spending weeks of researching healthcare policies, I'm honestly starting to understand why fixing it has been so difficult. Hello and welcome back to my channel, not in Kansas anymore, where we talk policy over politics. And over the past few videos, we've talked about the American healthcare system, the National Healthcare Plan, proposal, healthcare costs, private insurance, and where the political and economical pushback would likely come from. But for this final video, I want to take a step back. Because the more I've looked into healthcare policies, the more I have realized something. The issue is unbelievably complicated. And honestly, I'm starting to understand why politicians from both parties have struggled to deal with it for decades. I mean, apparently, not everyone knew healthcare was this difficult. But all jokes aside, I think most Americans feel the same frustration. People know the system is expensive. People know that the insurance is confusing. People know that medical debt is a real problem in the United States. But once you start looking at how all the pieces connect together, you realize healthcare isn't just one system, and that it has millions of jobs tied to it. So for this video, I don't want to pretend that I have all the answers. And I don't know for sure if the National Healthcare Plan we've been discussing is the right solution. But I do think it's fair to ask whether the current system makes sense anymore. Another thing I don't know for sure is if the numbers would actually work exactly as they are written. Because when you zoom out, it almost feels like we have built multiple overlapping systems instead of one cohesive structure. And each one was put in place to try and solve a different part of the problem while providing the same service as the other parts. The reason the National Healthcare Plan stood out to me is pretty simple. If you remove the duplication, if you simplify the billing system, if you reduce the administrative cost and overhead, then at least it seems possible that the total cost could come down while coverage is expanded. Now, I'm not saying that that would automatically happen in practice, but on paper, I think the logic of it is at least worth examining. One of the changes, though, that I would personally make would be the payroll tax structure. Instead of employees paying the 12% and employers paying 6%, I would probably flip that. Mainly because employers are already heavily involved in healthcare costs through wages and benefits. And in theory, consolidating those costs into a single system could create a more predictable long-term business expense. But again, this is exactly the kind of real-world testing and economical modeling that would need to be done. Biggest thing I've taken away from this series is that health care reform isn't hard because people don't care. It's hard because so many systems depend on it. Insurance companies, hospitals, pharmaceuticals, employers, employees, government programs. And there are even entire industries that are not required for health care that are tied to our healthcare system. So you're not just shifting one system, you're shifting an entire ecosystem. I think what surprised me the most is how easy it is to underestimate the complexity from the outside. On the surface, healthcare feels like it should have one simple solution. But the deeper you go, and the more every solution creates a trade-off. And that's probably why this debate has lasted so long. Because people aren't just disagreeing on policy. They're working from completely different understandings of how the system truly functions. If you've been following the healthcare series, I appreciate you being here. As always, I'll link a PDF to the full policy in the description if you want to read it yourself. If you like my content, please share, like, and subscribe. But most importantly, comment. I want to hear your perspectives. At the end of the day, I don't think healthcare is something that gets solved overnight. It's something that gets managed, adjusted, and slowly is reshaped over time. And maybe the most important part of the conversation isn't finding a perfect solution, but understanding the system well enough to actually improve it. Again, thanks for watching the series, and I'll see you in my next video where I attempt to tackle infrastructure. Thank you and goodbye.